Hi, my name is Topri Tohi, and today I'll be talking about the Brain MRI. Now, for the Brain MRI, I grabbed the best head coil we have, usually HD 8 channel HD brain coil, but if not, I can also use the birdcage one. Now, I have the patient going head in first, laying on their back. Now, my laser is lined up at the glabella, that spot right between the eyebrows, and it makes sure that their head is centered in the scanner. For the slices, axial, I line them up between the genium splenium of the corpus callosum and cover from the top of the brain all the way to the down to the foramen magnum. Now for sagittal, I angle between their hemisphere and cover left to right without chopping off the temporal lobes. Now for coronal, I line up a parallel brainstem and cover from front to back. Now, for the MRI brain, the circle of Willis, it's basically the same setup, same coil, same position, same lobella landmarks, and it's usually done without contrast using a 3D axial time of flight sequence. Now, planning is the same exact as axial brain, but I cover just from above the corpus callosum down to the foramen magnum. Now after that, I do post processing with an MIP, clean up any extra vessels, and save the image rotating or front to back view. For the MRI neck, I switched to neurovascular array coil because it covers down to the aortic arch. Patients still head first on their back, but now my laser at mid neck, about an inch or two below the chin. We start with a 3 plane localizer and then a sagittal phase contrast localizer for planning. Now, for most carotid are scanned with contrast and a 3D coronal sequence, and I use Floral's triggling to time it exactly as contrast hit the carotids. When it's done, I make the MIPS and save the views just as the brain MRI. And that's pretty much exactly how I would run a brain MRA circle of Willis, and the MRA neck. Thank you.